I want to go ahead and quickly touch on babies and belly buttons. So with it in mind, whether it's back at the rig or the ER, when a baby pops out, a couple things come into play. The first of which is when you clamp the cord, how many times do you clamp is called twice. How many times do you cut is called once. Remember, the first law of Home Depot is simply measure twice, cut once. Because if you only clamp once and you cut once, well, somebody's going to bleed. So that's why you clamp twice and you cut somewhere in the middle. Take that one step further, and that's how close to the baby do you put the clamps is called a couple of inches. Right? 6 feet's probably a bit extreme. But leaving a little bit of cord for the nursery to play with if the baby gets sick is a really appreciated gesture. So when you have a baby who's sick, you can try to start a peripheral, but what's a whole lot easier is having your doc, your NP, or your PA go ahead and pop in a belly button line. Now up in the nursery, they do fancy umbilical lines. In transport in the ER, we do it a whole lot faster. And that's called, we measure it and thread it. Meaning if you have 2 inches of cord, if you thread it in 2 inches, you're probably going to hit the vein that you're trying to hit. So when you're trying to practice with this technique, couple ways you can do it. They make umbilical cord models. And if you played with them, you can see how there's the 2 thick arteries and the 1 thin-walled vein. In this one, it's hard to miss because there's only 1 hole to choose from. Or an educator made this for me, where she took an adult endotube, put 2 tiny ones inside, which are the arteries, and 1 little bit bigger with some blue marker, and created your umbilical artery and your umbilical vein. However, with that in mind, there's 2 techniques that the books talk about to do this. Number 1, you'll see described how you can take an IV catheter and very easily thread it into the big gaping hole, which is the vein. And the problem is, depending on how much umbilical cord you've got and how much baby fat you've got, your IV catheter may not be long enough to actually hit what you're trying to hit. What works far better in real life is to use an umbilical catheter. And an umbilical catheter is 1 foot long. It's more than long enough to hit what you're trying to hit. And it's small enough to easily thread into the big gaping hole. However, the question that comes into play is, can you accidentally put it in the artery? And the answer is yes. But remember, up in the nursery, they intentionally put them into the artery. The difference is the arteries are spasmed closed. That's important. That's God's way of saying that if you're able to put something in there, you probably ought to know what you're doing. Versus the big gaping hole, which is God's way of saying the baby needs an IV, go here. So with that, the way we do that is you see that we've got 3/4 of an inch of cord. So if one person gently threads in about 3/4 of an inch, and while one person is threading, the other one is gently sucking on the syringe. And when we see blood that comes flying back into the syringe, we know we've hit what we're trying to hit. And how do you tape it is actually very simple, and that's called rip open your IV start kit. Take a Tegaderm Opsite, whatever you want to call it, just take your clear dressing and just mosh everything all together. So, moral of the story, if you've got these to practice with, that's wonderful. If you happen to have an OB department that lets you play and you've got human, in our case, preserved, donated umbilical cords, and you've got the ability to play with them, it is absolutely unparalleled because every cord looks a little different. But you're always going to see at least 1 artery which looks like this. And if you give it a little love and you play with it, the big gaping hole is going to be the vein. Again, most babies do not need IVs. But if the baby looks sick, until the NICU or transport can show up and happily take the baby off your hands, If you've got an umbilical catheter and you've got an inch of cord threaded in about an inch, and when you see blood, you've hit what you're trying to hit, you're ready to go.